Have you ever tried getting mental health care? It can be exceedingly hard to find a provider who will see you, and even when you do find someone, they often don't take insurance. Does it have to be that way? Today's guest says no. Hi, everyone. I'm David Williams, president of strategy consulting firm Health Business Group and host of the HealthBiz podcast, a weekly show where I interview top healthcare leaders about their lives and careers. My guest today is Dr. Tamir Aldad, founder and CEO of Mindful Care, which seeks to infuse convenience into mental health care. If you like this show, please subscribe and leave a review. Tamir, welcome to the HealthBiz podcast.
Thank you. Thank you for having me.
Really interested to hear about what you're up to these days. I would love to start in the past, and it's not a psychological examination or anything, but I'd love to hear about your childhood, any childhood influences that have stuck with you throughout your career.
Yeah, so I was born and raised in New York on Long Island. Early on, had a very entrepreneurial spirit. I think I opened my first dog walking business when I was 8 years old. So always was eager to build something, create something, influence people to support me. And so I think that started at a very young age. Had my real first job at 16, was working for my senator at 17, Capitol Hill 18. So really, started, I was very eager to
Yeah.
be an overachiever early on. And then was never, satisfied. So kept pursuing more and more goals until it was medical school, getting my MBA, opening this startup, raising capital, constantly chasing a moving target and increasing the bar and exciting myself by wanting to reach what feels like impossible.
Great. Now that sounds awesome. Well, you partly answered my next question, which was going to be at your educational path, because I know about the physician side and MBA side. International relations, I think, as an undergrad, I'm guessing that came out of some of the Capitol Hill experience or things you're interested in at
Yeah,
that time.
yeah. You figured it out. So I
Yeah.
went to I went to GW for undergrad. Was very interested in political science and international relations. And GW had a really great IR program, so I thought that would pair nicely with my work on Capitol Hill. I was working for Senator Schumer at the time, so did that while I was pre-med. After that, went directly to medical school in New York. And then after that, was a research fellow at Yale School of Medicine for a while. Thought I wanted to be a researcher for life. And then eventually went back to do residency in general psychiatry, fellowship in addiction psychiatry. Somewhere along the way there, went to the University of Chicago to get my MBA. So certainly was very busy. And then towards the end of my MBA, wanted to solve a real problem that had social impact.
Yeah.
So started looking holistically at my education and my skill sets, the resources I have, the people I have around me, and thought that maybe we could build something to solve the mental health crisis with significant impact. And that's when I decided to pursue opening Mindful Care.
There's a lot of physicians who end up going to business school, and sometimes then they get a connection, with business people and different ways of thinking, and something they didn't realize was a problem, or they see it from a different angle. The way you just described it, it sounds like it was more of a kind of an analysis kind of post that. Were there things in your kind of MBA experience that said, hey, there's a big need for this, or you're not the only one that, that sees a problem, or there's a different problem from the outside, or was it more of kind of after that?
So the greatest impact came during residency. When I was a resident, we had a patient named Lauren who came to the emergency room. She was a college student who came home from school to visit her family. She found her mom had overdosed in the bathroom. Her baby sister was home alone. They were all rushed to the hospital. The mom had died, and Lauren came to us. We were managing the psych emergency room at the time, and certainly a really, really upsetting, traumatic situation for her to be in. But she didn't meet criteria for inpatient hospitalization. So we sent her home with an appointment to see a psychiatrist in the community. And then we found out a few days later she died by suicide. And that was a really upsetting, but also it really impacted me in that that shouldn't have happened. And
Yeah.
the system is broken that we couldn't get her an appointment soon enough, and we had no room to hospitalize her. And why was there a lack of resources? So that story stuck with me. And then when I was in business school, was committed to figuring out, is it possible to have a business that has social impact with sound economics? Uh, your knee jerk reaction is no,
Yeah.
right? They're almost mutually exclusive. You either have social impact and then you have golf outings and fundraiser dinners, or you build a business. I wanted to prove that they're not mutually exclusive, and that was really exciting in business school to find other like minded individuals at Chicago booth and tell them that this is a riddle we have to solve. There
Yeah.
has to be a way we could do this where we could put food on the table for our families while helping people. And we ran the concept through a competition called the New Venture Challenge and the Global New Venture Challenge.
Hmm.
We won first place in one of them, second in the other. And that's when we realized that the demand is extraordinary and we really need to go to market with this solution.
The way you described, I don't want to call it an anecdote, but the kind of the patient and the whole family experience that you had in residency, looking back on it as sort of like the perfect, your solution is designed to go against that sort of that
Yeah.
problem, writ large.
Yeah.
I want to talk about that, but I want to hear a little bit first about kind of broader set of issues that are affecting mental health in the country today, and maybe beyond. There's a lot of things that are pointed to, but I'm interested in your perspective, partly for your clinical background and also what you're seeing on the business side. Some things that I hear about and see, maybe in my own family or circles are about social media. That's a big issue. The whole political climate, economic distress, even the less it's less it's less taboo to talk about mental health, which also may increase the demand for it. I don't know, but how do you see the whole kind of mental health situation, and of course more broadly behavioral health, and thinking about opioids and other drugs as a factor in there as well.
Yeah, there's certainly a lot to unpack there. I mean, you hit on each one could be a podcast
Yeah,
episode. But I would say the the common denominator across all of them is an access to care issue, an
yeah,
access to affordable care. We have patients with Medicaid and managed Medicaid and Medicare, and even some patients with commercial insurance that have to wait 6 to 8 weeks to see a provider. In that time, they could decompensate, meaning their symptoms worsen. They could be a danger to themselves and others. If they have substance use disorder, they could relapse if they're triggered. So it is very, very high risk in terms of the environment. And there aren't enough solutions in place to protect these individuals. So um, it's very fertile ground for mental health crises. Now, juxtapose that, the lack of access to care with the fact that people are more aware of their mental health and more triggered. So there's this. It's a very terrible, frightening combination of the two because care isn't really getting better. Significant, even the work that we're doing, we're a drop in the bucket,
yeah,
right? We aren't small by any means, but we're not moving the needle that much. We're trying. We're
yeah.
certainly trying, but I wouldn't say that the problem is much bigger than just uh, than we could single handedly solve. But like I was saying, people now on social media are seeing things that they can't avoid. Let's say constant triggers.
Yeah,
They're constantly comparing themselves to others. They have a unhealthy uh, pattern of use and behavior with electronics and social media and engaging with others. And also the increased awareness and the lot you mentioned that it's less taboo.
yeah,
Um, that increases incidence and prevalence, even if it's partially artificial, right? I mean, there's that idea that if you create a new test or a new imaging, suddenly more people have the disease. Do really more people have the disease, or are you just better at detecting it, right? And that's what we're still trying to figure out. But I can tell you, all three of those, people being more aware, us being more sensitive to it and identifying it sooner, and access to care being poor, is really a very dangerous trifecta.
Yeah. So, I mean, you see this kind of throughout healthcare where you've got things, let's say, chronic illness where the near term results are not as dramatic as what you describe. Somebody who has maybe has or could potentially have suicidal ideation can turn into action very quickly. Somebody has diabetes, they miss their appointment or they can't get care. It has an impact. It takes a little bit longer. You'll often talk about like kind of the iron triangle in healthcare, right? Access, affordability, quality, pick any two. So other people realize there's a problem, but not that many people think they could really solve it. And I'm wondering, what made you think you could, if not solve everything, at least address it, in mental health, and are you able to do that to some extent?
Yeah, I think in the scenario where you're trying to do it all, you end up doing none. And we've seen a lot of people before us try to uphold the greatest level of quality with being the most affordable, with the most accessible. And it's really, when you try to do everything, you end up failing at everything. And from our perspective, it was prioritizing the affordability and accessibility to triage, and then focusing on quality for ongoing care. So it isn't that you have to do everything all at once. We assessed the kind of global problem that we see in mental health and assigned which of those is the most appropriate at which time of the care.
Yeah.
Meaning, at the time someone's in crisis, access is the most important thing. And for that, we offer same day, next day mental health, urgent care visits to triage the patient. And moving forward, once we've established whether or not it is a crisis or it isn't, it's an emergency or it is not, hospitalization is warranted or it's not, then we focus on what is long term a sustainable solution here. Well, it has to be affordable. We should accept insurance so people can continue coming and feel better. It has to be high quality, adhering to clinical standards of excellence. So we realize that you take the timeline, the urgency, and then assign what you could really focus on to each portion of that patient's mental health journey to make sure they're successful.
Yeah, I think sometimes I know I called it the iron triangle, and it makes it seem completely insolvable. On the other hand, sometimes the frameworks can get in the way, and I mean, you could argue, as I think you're partly doing that, like if somebody's in a crisis, accessibility and quality are kind of the same thing. You talk to somebody who's competent, somebody competent and certified, that's quality because you're addressing something right away before it then goes off a cliff and becomes harder to recover from, more expensive, and so on. So maybe some of these things, when you look at it the way that you're describing it and getting kind of that key thing to intervene on, maybe some of these things that seem like they're incompatible actually do come together.
Yeah, I can tell you most of our competitors are very focused on accessible
Yeah,
and quality, but on affordable.
yeah,
And that is, everyone's trying to fish for a big fish who's
yeah.
willing to pay hundreds of dollars an hour for services. I don't know. I mean, maybe that makes sense, but you're leaving behind a huge market share of people that need help, that are um, eager and willing and want support, and they're being neglected. And then those are the people that we want to be there for.
Can you help me understand what urgent care means in the context of mental health? It's funny because I think maybe it's straightforward, but I generally think, it's impossible to get an appointment. You could go to the emergency room. And I don't think of the equivalent being out there for urgent care where I can go in, maybe wait a little bit, but I should going to be able to get access and it's not at the emergency level. What is the concept and how do you actually pull it off?
Yeah. So for us, the idea of urgent care is we have designated slots throughout the day where we will do a risk assessment and triage a patient. So instead of doing a full comprehensive psychiatric evaluation that you would do if you're waiting to see a psychiatrist, we created a hybrid type of visit, which mirrors portions of a psych eval and a portion of an emergency room psych visit into what we call an urgent care visit, with the focus of triaging and assessing how acute your symptoms are. Meaning, we'll give you our opinion if it is appropriate to wait a couple of days or a week or two to see a psychiatrist, or we don't think in your case it's appropriate. So we basically want to be a alternative to someone who is going to the emergency room inappropriately. We certainly don't want to replace an emergency room. The same way, if you go to a medical urgent care with a heart attack or with a stroke, they're not going to treat you. They will
Yeah.
call an ambulance and send you to the hospital. There's nothing an urgent care could do for you if you're actively stroking or having a heart attack. Uh, Same thing with us. If you're having a real mental health emergency, you do belong in a psych unit, or you do belong in a psychiatric emergency room. Our goal, though, is to help the people that inappropriately go to the emergency room because they have nowhere else to go.
Yeah.
Those are the people that we want to be an alternative for.
Help me understand the issue about insurance with mental health. I've mentioned in the intro that you can find somebody, but a lot of times, they don't take insurance or they don't take your insurance. Is this all because there's so much demand that they don't have to, or is it hard for the providers to get set up, or what's behind this issue?
So, two things. One is for many insurances, the reimbursement is offensively low. So if the demand is so high, it doesn't make sense to see a patient at rates that don't even cover your overhead.
Yeah.
There's this was in one of my op-eds a couple of weeks ago that I was negotiating a fee schedule in Florida, and one of the therapy rates was $14 for 40 minutes.
Yeah.
If you prorate that $14 for 40 minutes to an hour, that's $21.
Yeah.
I don't know a psychologist that I can even hire for
Yeah.
$21 an hour. And that doesn't even include the overhead of the lights, the electricity, the rent, the EHR, the computers, the support staff. Whoever did the math there just doesn't make sense. So you're up against that. And then the other thing that you're up against is the demand is so extraordinary that you could cherry pick the patients that you want.
Yeah.
It kind of goes a little bit against the oath that we take as physicians, but it's a reality. At the end of the day, you have so many patients to pick from. Doesn't really make sense to take on the more challenging cases or the low reimbursement cases. So the physicians aren't properly incentivized, and the demand is so high that you could pick the cases that you want.
Got it. Talk to me about virtual care versus in person versus hybrid care. We've seen a lot of announcements just in the past couple weeks, really, about people getting out of virtual care, or even in the case of Walmart, getting out of healthcare altogether. And they actually had a behavioral health offering when they had started out. I don't know if they had continued with it. But what's going on in terms of virtual care, hybrid care? Where do you see the future?
Yeah, so interesting. I can't comment too much on some of the companies you mentioned, but intimately familiar with the space of virtual care and behavioral health, and different companies trying to do integrated care at different levels. I would say that our model is a hybrid model by design
Mm-hmm.
because of the flexibility that it brings and the added value from a compliance perspective, and also the quality of care for patients. Patients who feel more comfortable establishing a therapeutic alliance and rapport with their clinician in person have that option. Those that want to sometimes come in person when they're feeling acutely symptomatic can, versus when they're stable, they could stay at home. Some want to be at home for the entire journey. So we like offering that flexibility. I think it creates a better experience for the clinician and a better experience for the patient. And that's kind of anecdotal what I'm seeing at our facilities. Assessing the entire landscape of the space, I would say we have to be cautious with organizations that are purely virtual because it's unclear what exactly the future holds. So with billing and coding and fee schedules, it's unclear. With prescribing and controlled substances and the DEA, it's unclear. Patient demand in terms of preference could change. So people who are doubling down on a very large, robust virtual offering, I would just say we need to be cautious in case any of those change. That could jeopardize those companies.
So we talked about like how large the demand is, and how varied, and also that while you're sizable, it's hard to move the needle. Like if mental health is affecting hundreds of millions of Americans, it's hard to move the needle completely on that. Where are you focusing? Like, how do you decide what areas to focus on, and what sort of success are you seeing when you do?
Specifically,
Like from either patient population, type of disorder, geographic focus.
yeah, I think probably because we see every diagnosis, ages 12 and up, and every level of acuity, and we serve six markets providing both individual therapy, group therapy, substance use counseling, urgent care, long term care. Um, we cast a very, very wide net.
Mm-hmm.
So it isn't. The precision is different from, let's say, organizations that compete with us that only want to see top tier low complexity cases. They have to spend a lot more time. Like
Yeah.
if they say we only treat low complexity anxiety and depression for insurances that pay above the
Right.
75th percentile, well, that you have to really make sure you're dropping your hook in the right place.
Yeah.
You know,
Gotcha.
so we're not that. We really try to treat everyone. I would say, though, our target demographic mirrors the national incidence and prevalence data of mental illness. So we see primarily women 18 to 35, females, and that's consistent with where we see the most incidence and prevalence for individuals seeking mental health services. So, which actually just um, further demonstrates our mission, right? So
Right.
that
Right.
we're trying to target the people most in need, and our averages meet national averages. So we're certainly landing in the right place, but that's kind of how we're targeting our patients.
Okay. That makes sense. I understand now why you're, I won't say struggling, but wrestling with my question, which is that your focus is on accessibility and affordability, which is inherently appealing to kind of a broad swath. So
Yeah,
it's more self-selected as opposed to you described to me the cherry picking approach, which is what you're not taking
right.
um, in order to get there. So you've had good success. Where do you see things going over the next, I don't know, 3 to 5 years? What's the plan for the company?
So we're currently licensed in 14 states. We have brick and mortar facilities in six. The goal is to continue expanding and bringing the model to more and more states. Right now, we're seeing through our referral partners that they have friends and friends of friends that wish our services were available in their states, and our goal is to get there. So we hope to continue expanding and increasing access to markets we've yet to get to.
Have you had a chance to read any books lately? Anything that you might recommend?
So we recently implemented. There's a book called Traction, which is the entrepreneurial operating system of how to run a startup. So we recently, as a leadership team, we recently finished reading that and implementing some of the strategies there to improve accountability and output and work together as a team. So that's certainly a good book. And then the Body Keeps the Score is an excellent mental health book on trauma and dealing with trauma. So on the clinical side, The Body Keeps the Score is also a really good book that we recently read.
Sounds good. Sounds like I should read both of those. On traction, I often say, there's no friction, there's no traction. That's what I usually say when people start arguing, and I do believe
Yeah,
in that. But now I should probably read about it and learn something more.
there you go. There you
Great.
go, for sure.
Well, Dr. Tamir Aldad, founder and CEO of Mindful Care, thank you for joining me today on the HealthBiz podcast.
Absolutely. Thanks for having me.
You've been listening to the HealthBiz podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.